Have you ever felt a new lump or ache deep within your bones and immediately started to worry about what it might mean? It is natural to feel concerned when you notice something unusual with your body. But often, these concerns can lead us to think of the worst-case scenarios, when in reality, many bone growths are not cancerous at all. Benign bone tumors are non-cancerous growths that originate in the bone tissue itself. These types of tumors are characterized by several key features. They typically grow slowly, remain localized to one area, and importantly, they do not spread to other parts of the body, which is a critical distinction from malignant or cancerous tumors. While they can sometimes cause discomfort, pain, or even weaken a bone, they are not life-threatening in the way bone cancers can be. The fundamental difference between benign and malignant bone tumors lies in their cellular behavior and growth patterns. On imaging tests, such as X-rays or magnetic resonance imaging, benign tumors usually appear well-defined, often with clear, smooth borders, and sometimes a distinctive ring of dense bone around them. Unlike cancerous growths that aggressively invade and destroy healthy tissue, benign tumors tend to push aside the surrounding normal bone as they expand. Many benign bone tumors are asymptomatic, meaning they cause no symptoms whatsoever, and are only discovered accidentally when imaging is performed for an unrelated reason. When symptoms do emerge, they commonly include localized pain, a noticeable swelling, or a palpable lump that you can feel under the skin. In some instances, a benign tumor might weaken the bone enough to cause what doctors call a pathological fracture, which is a break that occurs from normal stress on a bone already compromised by disease, rather than from a significant injury. This distinct behavior is why medical professionals can often differentiate them. For you, understanding these characteristics is essential for navigating the diagnostic process. If a physician suspects a bone tumor, they will typically begin with a series of imaging studies, which might include standard X-rays, detailed magnetic resonance imaging scans, or computed tomography scans. These advanced images are invaluable for evaluating the tumor's precise size, its unique shape, and its relationship to the nearby bone and soft tissues. While imaging can provide strong clues, a definitive diagnosis often requires a biopsy. During this procedure, a small sample of the tumor tissue is carefully extracted and then meticulously examined under a microscope by a pathologist. This crucial step confirms whether the growth is truly benign, ruling out malignancy and ensuring that the appropriate management or treatment plan is established for your specific situation. It is also helpful to know some of the specific names of these common benign visitors. For example, osteochondromas are quite frequent, presenting as bony outgrowths capped with cartilage, often near growth plates. Then there are enchondromas, which are cartilage tumors that develop inside the bone itself, particularly in the hands and feet. Another example is a non-ossifying fibroma, which is frequently found in children and often harmlessly resolves on its own over time without any intervention. Even though these tumors are generally not dangerous, they are still monitored or sometimes treated if they lead to persistent pain, interfere with normal function, or significantly increase the risk of a bone fracture. For instance, a small tumor called an osteoid osteoma, despite its size, can cause surprisingly intense night pain because it produces chemicals called prostaglandins. Recognizing the distinct features of benign bone tumors offers significant reassurance and empowers you as a patient. This understanding helps you grasp why your doctor might suggest a period of observation, or why specific symptoms manifest. When you receive a benign diagnosis, it shifts the focus from battling cancer to effectively managing any symptoms and proactively safeguarding your bone health. This knowledge equips you to have more informed conversations with your healthcare team and to make confident decisions about your care journey.